Is postmenopausal uterine bleeding a sign for endometrial cancer?
Well, it's the most common sign of endometrial cancer. The difficulty sometimes is telling who's postmenopausal. But if you can establish that and an individual has bleeding, then that is the major sign that we have. It doesn't mean that most people with abnormal bleeding or bleeding after the menopause have endometrial cancer, but almost everybody who has endometrial cancer has abnormal bleeding or bleeding after the menopause.
And what are the other signs of endometrial cancer?
Well, fortunately, endometrial cancer presents very early, and so the major sign is that of abnormal bleeding. It's very uncommon for an individual to present after the menopause with endometrial cancer and not have bleeding. Now, before the menopause, it's a different story, and individuals, of course, normally menstruate, but also abnormal menstruation in certain individuals can be a sign of endometrial cancer, and that's a more difficult circumstance because not only is it more uncommon, but fewer women find it unusual to have bleeding, and therefore their diagnosis may be missed.
And do we have new drugs on surgical therapy against this cancer?
I'm going to say, is there any change in surgical therapy in the future for endometrial cancer? And the answer probably is no. On the other hand, are there approaches to endometrial cancer that are pharmaceutical in origin? And I would classify them in two categories. One is the prevention of endometrial cancer in high-risk women, for example, those who are obese, and those women often can have their endometrial cancer prevented with the use of progestins, be they inside the uterus or systemic. There are other pharmacological interventions for very early endometrial cancer that we've used for quite some time, and they may be applicable to future use in cases where we are happy that the endometrial cancer is confined to the endometrium. However, for most women with endometrial cancer, the approach still is hysterectomy. So the approaches to hysterectomy by minimizing access, such as with vaginal hysterectomy or laparoscopic techniques, I think are really what are going to be the future from a surgical perspective. But from a medical perspective, I think we have a number of things that will change over the next several years as we not only reduce the risk of this cancer occurring, but identify it early enough that it might be treated with something other than surgery.